when somebody is seeking out primarily implants and let's say they say, oh, I went to another dentist, they said I didn't have enough bone. We usually will offer a complimentary consultation where we will sit down with the patient and discuss what it is they're trying to do. In the case of implants, if they come to us and say, yeah, my other dentist said I don't have enough bone, the first thing we'll do is we'll take a look and we'll see, well, do they have enough bone? Because nowadays, with all the different implant systems out on the market, the different designs of the implants, some of them are fat and short, some of them are long and skinny, or called mini implants, and the availability of what we call a CT scan, which is something new in the profession in the last 5-6 years. We have one in our office. We're able to visualize all the bone in someone's mouth in 3 dimensions in under a minute, which is really nice because then we can go in and I can in virtual reality treatment plan their case ahead of time, and I can see, well, sometimes they do have enough bone, it's just located in different areas. And in the case of that patient, depending on what we're trying to do or what they want and desire, whether it's a full mouth set of teeth or maybe just a few, we can go in and say, okay, well, if we do this and this, we can change the treatment around just a little bit and we can still give you your teeth and we can find the available bone. In some cases, there are, where the person doesn't have enough bone. And so that's when we get into growing new bone. And this is really the most exciting part of dentistry today because it's huge and it's advancing so quickly. And procedures that used to take years in order to grow new bone, now we're able to do it in 3, 4, 5 months. So it speeds treatment up. It's less invasive, so there's not as much discomfort afterwards, and we can actually regrow bone in certain areas and put our implants in. Or even in some instances, put the bone in and the implant at the same time, which even speeds the treatment along even quicker for the individual, because everybody wants their teeth yesterday. And so we try to do that as much as we can, but there are limitations out there. But the nice thing today is with modern technology, there's ways around the person that doesn't have enough foundation. I think the majority of general dentists out there don't do implants, or maybe they just restore implants. And so a lot of the implants are being sent to the oral surgeon. They will send the patient to an oral surgeon, which is another office, and they'll have to coordinate the appointment with the other specialty dentist, have the implants placed, and then have the patient come back. And so there's a lot of coordination. And I think when patients get older like that, a lot of dentists are like, oh, that's going to be too much work for the patient, or maybe even the patient thinks, oh, that's going to be really difficult. I don't want to drive over here and drive over here, because it's hard for them to get around. So that's one of the big opportunities we have in our office, is that I am the surgeon, but I'm also the general dentist, so I can do the implants for them and do their prosthetics, or give them their teeth, essentially. I had a patient just this last week, Lynn, who came in, and she has her own dentist, but saw an advertisement we were running in the newspaper about implants. She came in to see us just to get an opinion because she was told she didn't have enough bone, and she's actually only missing 3 teeth. But she wanted those 3 teeth replaced, and she didn't want to wear a denture, which is what her dentist told her she would need. And when I first looked at her, I thought, well, I think your dentist might be right. It doesn't look like you have enough bone. We might have to grow some new bone, and that might add some expense and some time to the procedure. But I think the first thing we should do is get a scan and see what we can do. And 5 minutes later, I came back, and I told her, you know what? You have enough bone. It'll work. I already planned it out. And you can have your teeth the same day. And she was just like stunned. She was like, wow, really? And I go, yeah, and we can get started next week if you like. So that was really exciting. And so that's the benefits of technology. It's like, if you can see what you can do ahead of time, it cuts down on problems later. You can give people a better accuracy and idea of what can be done, how long it's going to take, how much it's going to cost up front before they get into a big, long procedure and then they don't know what's going on there.